Dr. Zain Obagi, world-famous dermatologist and founder of the Obagi Skin Health Institute in Beverly Hills, is well known for his peel treatments.
You know, chemical peels are the most popular procedures in the world.
He takes his job seriously, and we found out firsthand when our producer, Holly, experienced a peel for the very first time.
She has sun damage and she had a condition called rosacea. So this peel actually is meant to remove surface damage, while the cream program she will follow will be stimulating skin to renew the nice, healthy skin.
And Dr. Obagi takes it all to a higher level.
Now we are doing peels plus stimulation to renew the skin at the same time. We can teach a person using a cream how she can do a peel on her face at home at her convenience. 100% safe.
Now, if the sun damage is much deeper, Dr. Obagi has what's called the Zeo Medical 3-step stimulation peel.
We remove the damage, we stimulate the repair, and we calm the skin. So eventually the results are wonderful. Now for the much deeper damage, we have something called the controlled depth blue peel, which is something done in the office. That's the only peel where the patient may need to stay at home for about a week, 8 days average, to remove most of the damaged skin. After that, they will have a tighter, smoother, younger looking skin.
Of course, he doesn't stop there. Dr. Obagi takes the treatment of sun damage another step further.
Before we do the peel and after the peel, we also assist the skin to repair the damaged DNA induced by the sun and help skin to renew itself. And we can maintain people looking the best and young indefinitely.
Now, a big question you may have is how often should you have peels?
The lighter peels, I will say 2-3 times a year would be fantastic. And if we need to do a deeper peel at home, we usually do it every 4 or 5 years.
According to Dr. Monica Kurapolsky, a board-certified dermatologist, there are some key steps women can make after a peel.
You want to make sure you're on a good topical retinoid, some products with antioxidants, avoid the sun or direct sun exposure.
As we've learned, there are some common skincare mistakes.
People with acne come in and say they're putting cocoa butter on their face. Not properly treating acne is another big mistake. And it's really sad because those people get scarring and permanent discoloration that if they start when they're young with things to prevent acne and treating it aggressively from the start, they can prevent a lot of that from happening.
And Dr. Kurapolsky wants us to know how important proper nutrition and sleep really are to overall skin health.
When you don't get enough sleep, you're more stressed out, you have higher cortisol levels in your blood, and your skin breaks down faster. So making sure you get enough sleep, avoiding stress if you can, and then a healthy diet is very important.
She also speaks highly of the man who she feels privileged to work with side by side.
It feels pretty incredible. He's the same guy that I was studying all through school, and he's famous all over the world. People, they come in with just terrible pigment problems in their skin, and they're almost in tears, and he just comes in and they leave happy, and they're patients for life.
Bringing you the best of California from Beverly Hills, I'm Georgette Copes for California Life.